Welcome back to the Morning Blend. No doubt about it, people with chronic sinus problems have a lower quality of life. They often report suffering at home, at work, and just trying to enjoy activities. So, do you have to just live with it? Our next guest did for 68 years. Steve Gardner is here because he recently had a procedure that allows him to breathe much easier. Dr. Kandula of Advent is here to explain exactly how it works. Great to see you guys.
Great to be here.
Thank you so much. Let's talk a little bit about this quality of life thing. You must hear this in your office. I mean, you hear a lot about medical problems and all that, but this is a problem in my life.
Yeah, it's a big one. And it's actually, out of all the different medical issues you can have, this issue, sinus issues, nasal congestion issues, actually create more quality of life impact than almost anything else that can be going on. So, you know, it's a big factor. And a lot of folks just sort of just kind of muddle through, deal with it. And
yeah, they think they have to deal with it. It's like,
really,
oh, I've always had this.
Yeah, it's just the way it is. It's the way life is. And it's a lot of times it's until you're on the other side of the fence is where you finally say, wow, boy, I wish I would have done something sooner, kind of a thing.
Yeah, well, and one of the things that I didn't mention, but I'm sure is true, is that it really affects sleep. Somebody's ability to get a good night's rest, which can affect every aspect of our lives.
On down the line. I mean, so sleep is a big factor. I mean, it's the start of your airway is your nose. If your nose isn't working, then the dominoes start falling downstream, and that doesn't help you there. But even, you know, sinus infection issues, same thing. If you get a chronic infection in the sinuses, if you'll run down, just not your 100% self, and it's a really big factor, and it creates issues in other areas for many folks.
I want to talk about balloon sinuplasty because this is a procedure that we're talking about. And before you introduced it and had this procedure available in Wisconsin, what was sort of the primary way or the go-to way of treating this?
For a lot of folks, there wasn't a good go-to way. So we have traditional sinus surgery, which is still something that works, and it's a good thing. But for many folks, it's kind of overkill for the issues at hand.
Yeah, because it's surgery, anesthetic, long recovery.
Exactly. So, I mean, again, there are many folks that is the right answer. But if it was overkill for you back before we introduced balloon sinuplasty, there wasn't a good option. So it was really, maybe I'll just sort of keep on gritting it out. And so with this option, it really is a nice in-between option as far as we're doing something, making big changes in key areas, and really, kind of flipping the script and making folks better, which is a big deal.
So you don't make an incision, balloon sinuplasty. There's not the anesthetic and not the long recovery. How does it work then? Yeah, so
what it's doing is using a tiny angioplasty type balloon up in the sinus areas, and we're inflating that. So we get it in the right spot and we inflate it. And it sounds like, okay, that's and this is actually me having it done on myself. But anyway,
I love that you share this video of you having it done.
So that is my nose, my sinuses. But literally, it's something we can numb up the nose very nicely. So that makes it an easy thing to make possible. Get the balloon in the right spot and inflate it and open things up. And so it's very similar to going to the dentist's office and having a filling done or something like that. But it's a different area, and so in the areas we're dealing with, it's a big change. Instead of having a tooth that's fixed, now you have maybe your nose that's fixed or your sleep that's fixed.
Well, and a big change in terms of relief, but it's a very small amount that we're talking about. That
6 millimeters. So 6 millimeters doesn't sound like much, but in an opening that was closed before, going from closed or shut down to 6 millimeters is a world of difference.
All right, so let's talk about this, Steve. You just had it about a month ago.
Right.
Quick recovery, is that true?
It was so quick that I actually, if I had not been retired, I would have been fighting with people to let me go back to work right away after the procedure. As it is, I took the afternoon off, just relaxed.
That easy.
I've been in healthcare for more than 40 years, and I have never experienced anything in my life that was as simple as this. Dr. Kandula says it's like going to the dentist. No, it isn't. It's easier. This was a lot easier.
So what was going on? We said earlier you weren't breathing for 68 years. You were breathing, but not very well, right? And it affected your quality of life?
Right. I have always had seasonal allergy problems. But over the last couple of years, it seemed like in the winter, when I shouldn't be having those problems, I was having more and more headaches and a lot of pressure, a lot of congestion. I was having trouble sleeping because I couldn't get air in through my nose. So I'd sleep with my mouth open. Then I'd wake up in the middle of the night with my throat terribly dry and hurting. So I'd have to get up and I'd get a big bottle of water and drink that, go back to bed. And of course, when you're 68 years old, you have a bottle of water in the middle of the night, you're going to be getting up again shortly. So.
Exactly. And did you notice relief very quickly?
Instantly.
Instantly.
Instantly. This is the thing that I certainly would like to emphasize to people was it was immediate. And, it's continued over this month just getting better and better and better to the point that I can't believe that I wasn't experiencing this kind of breathing all my life.
It's amazing.
It is.
Well, congratulations to you for feeling that way, and congratulations to you for getting them there. You have some free programs, because I think people have questions about this. They want to know a little bit more about how it works, what all is involved, and I think you've done a great job of explaining it. But you do these programs as a way of kind of helping people understand it better.
Yeah, you know, it's a way for people to kind of are curious about these issues or have these issues come in, and we'll talk about what we're able to do, get you some answers. At the very least, just explain what's going on. So that's sort of a nice thing, but also, like I said, explain about what we can do and to help the cause.
It's wonderful, because people suffer way too long. These programs are free. One coming up Tuesday, September 27th. That's next week, Tuesday at 6 p.m. at Advent. Their office is located on North Mayfair Road. Then Thursday, September 29th, the same week at 6 o'clock. That's at the Advent located on Port Washington Road, which is in Mequon. You can register online for one of these free programs, find out more, have a consultation with Dr. Kandula by calling 414-771-6780 or go to advent.md/event-forum. And I think the bottom line, you would say this too, Steve, is don't suffer anymore.
Don't wait 68 years, that's for sure. Go, get it done.
Nice to see you guys.
Nice to be
so
here.
much.
Thank you.